Hi, my name is Cade Weibel, and this is my research project on supraventricular tachycardia and the two major treatment routes for it. The basis of this project will consist of comparing the two major treatment routes for supraventricular tachycardia, or SVT, and determining which one is better for the patient in the long run. So, what is SVT? SVT occurs when a patient's heart rate falls between 150 and 200 beats per minute. This typically occurs because of an accessory connection between the atrium and ventricle of the heart, or because of an accessory electrical conductance in the ventricle of the heart, which causes such a rapid heart rate to occur. There are two major types of SVT. One is atrioventricular nodal reentrant tachycardia, and the other is atrioventricular reciprocal tachycardia. This is what SVT looks like on an EKG. Here we have a heart rate of 160 or 190 beats per minute, which is very high and is typical of supraventricular tachycardia. And here we have a rhythm. The PQ or ST complexes appear to be normal here, but there's just so many of them in such a short span of time, hinting at such a rapid heart rate. So this can be treated mainly in two ways. Either vagal maneuvers will be performed, or an adenosine push will be performed. Adenosine is an IV medication that blocks the AV node from sending electrical impulses from the heart to the heart. So it literally stops the heart from beating for about 2 seconds. Whereas vagal maneuvers or sort of natural manipulations that stimulate the vagus nerve in hopes to slow the heart down back to a normal rhythm. We're now going to talk about the pros and cons of each one, of adenosine and vagal maneuvers, and we are going to look at which one is better for the patient. So, vagal maneuvers. Examples of vagal maneuvers are bearing down, coughing, gagging, or submerging your face in cold water. Again, all in an attempt to stimulate the vagus nerve and relax the heart. The positives of doing this are that they're more pleasant for the patient, and that they can be taught to patients, so that if they have recurrent SVT, if they have an extensive history of it, then in the future when it happens again, they won't have to go to an emergency room or to a clinic. They can at least attempt to do some vagal maneuvers on themselves. Another benefit is that it's non-invasive and it's just safer than using adenosine. So let's look at the cons of a vagal maneuver. The cons are that typically vagal maneuvers just don't work. They're great in theory and they're great when they do work, but oftentimes they don't work the way we want them to. Even if they do successfully lower the heart rate will typically climb right back up in about 30 seconds to a minute. So now let's look at adenosine. Adenosine, again, is an IV drug that stops the heart from beating for a couple of seconds, which allows the heart to kind of reset back to a normal rhythm. The pros, the good things about using adenosine is that typically it works, and it works very quickly. It works if the patient is for sure in SVT and if they are stable. So that's the main good thing about using adenosine. The potential negatives of using adenosine are that if it's used incorrectly, or if it's used on a patient that is in a cardiac arrhythmia other than SVT, it can potentially put them into cardiac arrest, which is not good. And another negative of using adenosine is that it's invasive, so an IV has to be put into a patient's vein to deliver the medication. So, in conclusion, which route is the better way to go to treat a patient with SVT? According to a trusted coworker and mentor at the LSU School of Medicine, vagal maneuvers are the optimal way to go, and they are the treatment of choice for emergency physicians, because although they don't always work, and they probably won't work, it's better to at least try them, because if they do work, they're far better for the patient, and they're far better for the physician. You're not taking as big of a chance as you would with adenosine. Something could go wrong, and it's just far less Vagal maneuvers are far less risky, and adenosine is far more unpleasant for patients. So vagal maneuvers are the treatment of choice. They are always tried before adenosine is pushed. Thanks.